The healthcare crisis. It has been a wild few weeks of proposals and rejections, and now a delay in the vote on the Senate Republican plan.
But at the heart of the issue is people. So starting tonight and all day tomorrow, we're taking an in-depth look at how this critical issue impacts us all.
Let's start with Dr. Frank McGeorge here to help explain why this got so complicated. Doc?
Well, Devin and Kimberly, how did we end up here? Why is our healthcare system so messy and complicated? It happened one piece at a time, starting a long time ago.
Over 100 years ago, medical care was very basic and fairly inexpensive. The biggest health concern of the time related to dangerous working conditions. A single serious injury or illness to the main breadwinner in a family would send them into poverty, and early insurance, known as industrial injury and sickness funds, slowly sprouted up.
Historically, insurance was designed to cover catastrophic things that you could not afford, that would bankrupt you effectively if you ran into them. Have we made some progress, actually?
Mary Ann Udow-Phillips directs the Center for Healthcare Research and Transformation at the University of Michigan.
Every developed country in the world other than the United States is clear about how they've designed their health system. They actually have social policy where they have said, this is how we're going to deliver and finance healthcare. And you can almost always identify a single entity that is responsible for healthcare in just about every country in Europe or Japan or elsewhere in the developed world. That is not true in America.
The complex system of coverage in America evolved. It was never thoughtfully designed, mainly because we've never answered the question of whether healthcare is a right, a product to be bought and sold, or an essential government service like roads, education, or police and fire service. As you'll see, America was driven in different directions at different times.
At the turn of the century, medical science became more developed and care became increasingly more expensive. Interest in broader nationalized health coverage grew, but it was stifled by events in American history. Early problems came from seemingly unlikely places. For example, during World War I, there was furious anti-German sentiment, and the nationalized healthcare system Germany had adopted was considered anti-American. Then, the Great Depression moved the needle in favor of private health insurance. Hospitals needed to attract patients, so they developed plans where, for a small monthly fee, short-term hospitalization would be covered. This was ultimately the birth of Blue Cross. World War II moved the U.S. even more toward private insurance, and specifically employer-sponsored plans, linking health insurance to employment. Here's how it happened. The war caused the government to limit wage increases with one loophole. Employers could compete for workers by offering health insurance as a fringe benefit.
Insurance and employer-sponsored insurance was really developed in that period of time in the 1940s. Because employers could use it as a benefit to attract a workforce. So we saw huge growth in employment-sponsored insurance in the 1940s and World War II.
She points out employment-sponsored health problems created other problems.
But that meant we left out a whole bunch of people, right? We left out seniors because they didn't work, and we left out people in poverty. So in the 1960s, we developed measures to cover some of those people, Medicare for seniors and Medicaid for some people in poverty. And so that's made it a very complicated system.
Since the 60s, both Medicaid and Medicare have stretched to cover even more people. Obamacare grew the ranks of the insured, but failed to address other issues. The fact remains, at every opportunity to start over with healthcare, we've elected to make smaller changes instead. And that's created the complex puzzle we face today.
We know there's a lot of concern about where healthcare is going next, so I'm teaming up with Help Me Hank to sort it all out. And tomorrow at 6 a.m., I'll tackle pre-existing conditions, what they are and why they matter so much. Then at 4, Devin Skillian looks at the politics behind the plans. And at 5, what you need to know about the latest healthcare proposal.
And then at 5:30, Dr. McGeorge will take a look at the Medicaid piece of the puzzle. It's very confusing. You'll see why experts say it could actually hurt Michigan the most. At 6 o'clock, how does this affect all of you that get your insurance from your employer? Well, the answer to that question may surprise you.
And tomorrow at 11, the impact on our kids. We're going inside the healthcare crisis all day on Local 4.